Hello, a very good evening, everyone. Hello there. Hi, Gayatri. So today we have a very interesting and very sensational topic, which I'm sure a lot of people want to know more about it. And there are a lot of, I'll say, controversies. There are a lot of myth, and also there are some misleading knowledge as well on this topic. Well, today we are going to discuss everything about the topic. So let me wait for a couple of minutes more. Let me add more people. Let us just more people join in the session, and then we'll start the session. And meanwhile, let me tell you that you should be having your notepad and pen because, joining us today would be Dr. Krishna, who is a very well-known oncologist, has been working in the field of cancer since 20 years, more than 20 years now, and has his expertise in cancer very much by treating thousands and thousands of patients till now. So let us just wait for a couple of minutes, and I'll wait for Dr. Tarang also to join the session. So, meanwhile, I'll just share a little bit of statistics. 1 in 4 women who are diagnosed with cancer are detected by are suffering by breast cancer. This research has been done by International Agency of Cancer Research. In fact, the year 2020, the statistics of year 2020 says that more than 2 lakh patients were reported of breast cancer. Well, breast cancer is a huge topic, and like I said, lack of awareness is always there. And of course, October has been dedicated to this pink ribbon, which is for breast cancer, where we talk about breast cancer. It's in Breast Cancer Awareness Month. And that is the reason I'm here today to talk about breast cancer. What are the do's, what are the don'ts before October ends, so that we can provide you maximum knowledge on breast cancer on this topic. And also, this is a continuous topic, so you cannot end this topic by speaking about just for a month. It's a continuous topic. The discussions should be always there. In fact, let me look for Dr. Krishna. He would be throwing a lot of lights on this topic, on this subject today. So without much delay, I'll add Dr. Tarang now. So Dr. Krishna is a very well-known doctor in the field of cancer. Like I said, he has been practicing more than 20 years and has treated thousands, or maybe I can say lakhs of patients in cancer. Here he is. Hello, Dr. Tarang, how are you?
Hi, Dr. Deepika. I'm very good. This is my first Instagram live, so I'm super excited.
Yeah, so of course we know that you have done a lot of live sessions, you have done TV shows, you have spoken on Facebook lives and various other channels, but good to see you on Instagram live as well with your wife for the first time. So
super excited, but yet super nervous. I have given interviews in majorly all TV channels, but this is the interview this is the session where I'm super nervous, because when you're facing your wife who is asking you questions, because offline also you ask us questions, so that's where this is going to be super excited. But whatever best I can impart to your viewers and whatever best I can impart to your audience, I'm happy to help.
Well, today's session would be, of course, we do have conversations. Our dinner table conversations are about, various cancer and how he has been treating the patients, and how the patients feel so grateful about, the recovery, which is amazing. But we would, try to demarcate ourselves of not going haywire and sticking to the topic, because of course when family members and husband wife speak, there are chances that you go haywire. But I'll try and make sure that our listeners, our viewers here do not get upset, and you get maximum content out of it by Dr. Tarang's attendance today. So yeah, without much delay, let's just quickly jump to the topic. So Dr. Tarang, I just shared the statistics of cancer, that how breast cancer, that how vastly it is there. In fact, the year 2020, the statistics of year 2020 says that more than 2 lakhs women have reported of breast cancer, so which is a huge number, right? And a lot of time, we are not even aware, although October is an awareness month, but still, I feel that women do not know that what are the chances, like when do you find out whether it is breast cancer or not? How do you know whether it is breast cancer or not? What can one do to avoid, avoid the situations like breast cancer? And also, what treatments, what kind of preventive measure one can take, and also what are the tests, like how to diagnose. So I do have like ample questions for you today, and of course
Happy to help.
our topic is that 7 most important thing which you are going to sort out for us at the end of this session, that what one absolutely needs to know, what one should not be missing at all. So beginning from straight jumping to the topic, starting from the first, that there are so many types of cancer, right? So how do one know that she is suffering from breast cancer? Is there any initial stage, and what is that initial stage?
So what happens is most of the cancers that gets diagnosed, Deepika, is actually where the cancer is actually, where it's a saying when you say that horses have left the barn. So it is be diagnosed on the real-time basis. Now, what happens is most of the cancers generally, like so this is the most neglected part for any girl because they don't talk about it. Even if this is a simple breast examination, which has been so neglected out here, all around India, that they don't examine or self-examine the breast during taking showers. As simple breast examination would make it so easy, where any girl, any lady, any woman who is having any lump in the breast, or finds any changes in the breast, or finds any deformity in the breast, or it can be any small sign. It can be any small sign, even a small, ecchymosis or even a small bruise can be a first simple sign of cancer. Even a retracted nipple can be a sign of cancer. Even a small movable cyst can be a simple sign of cancer. But girls, women, ladies, they completely ignore it. They don't take care of it. And that's where this is the most neglected part. And most of the ladies, when they are being diagnosed with cancer, are of middle age or older age. When they actually feel that something has been sitting out there in their breast, they overlook it. They don't pay attention to it. And as simple as that, it gets worse. And that's where, all other protocols and therapies and harsh treatments any girl, lady, or woman have to undergo for. So what is more important is a simple breast examination. And that is the most neglected part. Had it been so prominent, so what I suggest to all the women who visits me, or all the people that I know, all my friend circle, your friend circle, is paste a simple message on a paper as a self breast examination, paste it on your shower. In your shower, either you would be taking it or your husband would be taking it. A simple note on the mirror of self breast examination. You need not be shying it for. You need not be feeling shy about it. But this is a self reminder. You keep simple post-its on your computer, on your desktop, on various places of knowing what to do about what you have to do in your list. You do your to-do list, task list, or any number of lists. But a simple reminder, a self reminder for yourself for a self breast examination can add it on to your, it can keep all the diseases and breast cancers at bay. And then even if you're diagnosed, that's a later thing. When you'll ask me questions, I'll explain it to you. But this is one simple exercise which I would like to tell all your audience, all your female audience as well. keep a post-it of self-breast examination, paste it on your mirror, and nothing to be shied about for. Rather, even if you have small kids, small children, this is a way to remind your even younger girls, if you have in your family, that yes, even you're 13 plus, when you are becoming adults, when you are growing up, this is a simple exercise that you have to follow it. The way you take a shower, the way you brush your teeth, this is a simple examination that you have to do every day, and it keeps diseases at bay.
I mean, that's a very good tip, I'll say, that, making it into a post-it and a self-reminder, so that whenever you are entering a shower, going to the washroom, you do that. But, you have also told that, mostly people shy up, they don't want to discuss, or maybe they feel that acha aisa hi kuch hai, theek ho jayega, maybe just anything. So when is the right time to report to a doctor?
So whenever you find it, that is the best time to report it. Whenever you find it, that is the best time to report it. There is no point of delaying it. What happens in India, and even I don't know, I've seen majorly in the north regions. I've met people majorly in those interior parts of Maharashtra, and those interior parts of south. The girls are really, or the women are really outspoken discussing about that. So we have centers in Bangalore, Hyderabad, and Chennai. The ladies are very prominent enough. I'm sorry, I'm not devising it, but that's where you see those cultures of people coming from Uttar Pradesh, Rajasthan, towards North India. They still, who are living in the suburbs, they are still shying away and discussing to their family members about that there is a lump in the breast. And the moment you have found it, the moment you have found anything awkward or odd when you're examining yourself, inform. Anything whenever you're finding awkward or something which is not normal, inform. You know your body. Everybody knows your body. Everybody knows their body, right? So whosoever is, so if there is something awkward, like had it been a lump here, when I'm moving my hand, I would find something. So whenever you find it, why to delay it? Check it out. Inform to the doctor, meet the doctor. Not that every lump would be a cancer. Not that every breast swelling might be a cancer. Not that every cyst might be a cancer. The only thing is people shy away in going out for, agar cancer diagnosed ho gaya to kya? Agar cancer nikal gaya to kya? Abhi to beti ki shaadi karani hai. Abhi to ye karana hai. Abhi to main yahan ghuma. Abhi to main ye karaun. Abhi to wo karaun. That's the myth. That's the thought. That's the when you have been diagnosed with cancer. Your life is not going. Rather, you are able to treat yourself earlier, You're able to treat yourself much faster. You're able to treat yourself much better and with the best possible recovery. Yeah.
Yeah, I mean, you very well mentioned that, people's shyness is one of the major reason when people do not report it timely, and generally the case when it comes to the doctor or to you or in our centers are generally of stage 2, 3, and furthermore. I think, when we talk about awareness month and awareness, I mean, more than that, ki टेस्ट कैसे पैल्पेट करना चाहिए ब्रेस्ट को, ये भी बताना होगा हमारे को, अवेयरनेस इसकी भी जागनी होगी, दैट देयर इज नो नीड टू बी शाय ऑफ, particularly with the young teens, with the young adults. I'm sure it must be a very uncomfortable topic. I mean, it's for all age group, and for older women, for anyone. So that hitch should firstly go away. I think we should be more vocal about what we are facing, what kind of health issues it is happening, whether it is inside your body, on your body, or around your body. So that is the most important thing. But Dr. Tarang, tell us that how, which is the maximum time when the women face breast cancer? Is it the younger age group? Is it the older age group? Is there any demarcation that the older women should be much more careful? And if the older woman, then what age group is the maximum risk?
So whosoever is seeing more life has been more diagnosed with cancer. I would take it more simple. So yes, breast cancer is very much common in middle age as well as in older age. In younger age, it is not there that much as compared to the ratios I'm talking about. So those who have seen more life, I would say, are more prone for breast cancer. However, it all depends upon how your mindset is, how your lifestyle is, how much of how much of the lifestyle that any girl is, or any woman or any lady is living up with, and that's how it is. So it all depends upon. So nowadays there's no criteria as to middle-aged women get less cancer as compared to an old age. But yes, as compared to younger ages, middle age as well as older ages are much more common and prone to breast cancers for sure. Yeah.
Yeah,
Are you there?
so I think the menopausal age, or the early menopausal age, and women who
Yes.
are touching around 40, I think that's the major, probably when the
Majorly
hormonal
40 plus. Yes.
imbalances, yeah, the hormonal imbalance happens the maximum time. But yeah, I mean, one need to do their regular checkup right from the early age, so that it becomes a part of your daily routine, and then without subconsciously also you are doing it like a routine work, like your everyday brushing your teeth, etc. So
Yeah.
tell me that when diagnosed with cancer, firstly, how to get diagnosed, like what are the tests and what are the must do tests, because we hear so many things कि mammogram कराना चाहिए, patch test होता है, there's so many tests, but what is that test which one should be getting it done, and what are the tests which one can avoid getting done? Because of course the market is such, everything is there's so many new things coming up, and of course all the tests are very, very expensive. So many patients come to you also saying that they cannot afford all the tests. So what are the absolutely must do tests to find out whether you have any kind of breast cancer, and what tests are no need, or maybe worsen the situation?
Oh, fabulous question, Dr. Deepika. I mean, you're always great with questions. So, yes, so very, very important. So, the must do test is ultrasound breast, ultrasound both breast. The moment, I mean, what I suggest is if any girl, woman, lady, or even men are always advised to have a blood test whatsoever possible for their body, right? 40 plus, the moment you touch even 30 plus, you have to have one blood test, hemogram, liver function test, kidney function test, once in a year. Likewise, for every girl, ultrasound both breast is must for every girl once in a year, right? And ultrasound both breast is a simple examination, simple ultrasound which has no side effects, nothing. But yes, if any girl is doing it, any woman is doing it, that's the most simple form of getting the test done. एक simple ultrasound both breast का करवाना है, and उससे आपको पता चल जाएगा कि कहीं कोई lump तो नहीं है, कहीं कोई lesion तो नहीं है, कहीं कोई गांठ तो नहीं है, right? That is one simple test. If you have been diagnosed, or if one has been having a lump in a breast, then you should always go for ultrasound breast, number one. Number two, then mammogram. Number three, FNAC. Absolutely no for biopsy. What happens is, any girl, whenever they have been diagnosed with a lump, they always run to a gynecologist, and they go to an oncologist, and they advise for getting a biopsy done. Now, till the time you're sure, don't get a biopsy done. To find it positive, FNAC is a simple test where it's a simple test which says fine needle aspiration cytology. So fine needle means it's a very fine needle which the doctor puts into the breast lesion, takes out the fluid from there, and they aspirate the fluid out there, send it for diagnosis. And it is good enough to find whether they are malignant cells or benign cells, or how exactly is the lesion or lump out there in the breast. And it would tell about its nature too. So first is ultrasound, which is a must, which is mandatory. Even for those who are going for routine test and routine diagnosis, always get an ultrasound done. Number two is mammogram. At least once in a year, everybody should be doing it who is 40 plus. Even if you're 30 plus and you have been taking birth control pills, or you are taking hormonal pills or you are having frequent abortion, always get this test done, because mammogram and ultrasound would always confirm whether your breasts are absolutely normal or not. And then the third is, if the lump is confirmed and the biopsies, the FNAs, the ultrasound as well as the mammogram has confirmed it, then the simple thing is get the FNAC test done. And once FNAC is done, it is almost clear that whether to go for the treatment and what kind of a treatment that has to be chosen. It is as simple as that.
And you mentioned, not to go for biopsy the first thing. Is there any reason of you saying this? Like why not?
So what happens is,
a person goes for biopsy?
So Deepika, what happens is whenever anybody goes for a biopsy, it tends to multiply at a much faster pace. So till the time you're confirmed, so if you have to make a confirmatory diagnosis, ultrasound is good enough, mammogram is good enough, FNAC is good enough. It's great enough rather. But if you have to go for a biopsy, you have to be confirmed enough, because if you're not choosing the proper line of treatment, which is chemotherapy, operation, which is mastectomy or chemotherapy, why do you have to go for a biopsy? Because the moment a biopsy has been done, so biopsy is like taking out a tissue out of a breast and sending it for a histopathology. Now, when you are actually, so what happens is a lump has been there, the lump can remain silent for years. There have been ladies where there have been women out there, women patients out there who have come to us where the lump has been there for years together and nothing has happened. But the moment we got a biopsy done, within 6 months, it has metastasized to other organs. So, cancer में जितना आप कम छेड़ोगे, उतना जल्दी, उतना आप ज़्यादा safe रहोगे. Cancer में the moment a knife is being inserted, the moment the biopsy is being done, it tends to erupt at a much faster pace, right? So, as much as possible, if you can avoid it, nothing better than that.
Yeah, it makes sense, obviously, because, cancer itself is like too much growth of the cells, unwanted cells, which are the cancer cells. So, disturbing that area with any other kind of thing, it might be of course, that absolutely makes sense. I think Dr. Tarang has lost his signal. Tarang, are you there? So, just pour in your questions, guys, because by the end of the session, we would be taking some questions from you guys also. So, yeah, so now we know that, biopsy first thing nahi karna chahiye, because of course, unnecessarily kisi cheez ko chhedne ka fayda nahi hai till the time you're absolutely sure. But you've also mentioned that not all the tumors are cancerous. Not all the tumors are, malignant. They can be benign. They can be malignant as well. So how do one differentiate that ye malignant hai ya fir ye benign hai? And when is the absolutely important point to start going for medicines?
So whenever a lump has been diagnosed, that's the best time to actually go for the medicines. Whenever a lump has been diagnosed, the treatment has to begin the moment you're being diagnosed with cancer. Just that, never make hasty decisions. What happens is people start making hasty decisions where they're not pretty sure enough. Are jaldi se lump diagnosed hua hai? They go to a hospital, get a biopsy done. Biopsy says it is metastatic adenocarcinoma, or it is fibroadenoma, or it can be any normal simple cyst as well. Still, the doctors would advise you get a surgery done. When the surgery has been done, the histopathology report comes. Histopathology report shows that yes, it is a XYZ type of a cancer. The moment they are diagnosed with cancer, they immediately say, oh my God, this is the chemotherapy protocol that has to be taken. They go for different types of receptor tests and accordingly decide upon that these are the therapies that patient has to undergo. Now, whenever you are making decisions so quickly, in haste, out of fear, you are never making the right decisions. Always take a first opinion, second opinion, third opinion, no matter what, fourth opinion as well. But be pretty sure enough what decision to make, what treatment to choose, how to go about for what test to be done. So ultrasound clearly tells us that, it is BRADS 1, BRADS 2, BRADS 5, BRADS 4, and that tells us what exactly is the nature and extent of the lump. Then once you are getting an FNAC done, FNAC clearly shows that this is XYZ type of a cancer. I'm not going into scientific names because of the simplicity of the conversation. And the moment it has been diagnosed as cancer, you have to be, one has to be very pretty clear enough. If they have to go for chemotherapy, immediately consult an oncologist. The moment they consult an oncologist, you have to choose what are the treatment protocols to be done. If one is pretty clear enough that he or she doesn't want to get any invasive surgery being done or doesn't want to get the breast removed, doesn't want to get a mastectomy done, then absolutely don't go for biopsy. If the chemotherapy protocol has to be done or mastectomy has to be done, biopsy is a must. Why? Because that tells us exactly what is the nature of that tumor or the lesion which is there inside the breast. The moment it has been diagnosed, then there are different protocols that one has to choose. If it is benign, nothing to worry. If it is benign, nothing to worry. You can take a simple procedure, not even the removal is necessary, not even a partial mastectomy is necessary. The medicines are good enough to dissolve up any kind of a lesion which is there, right? But if it is a metastatic tumor or if it is a malignant tumor, then yes, you have to choose a protocol which decides upon to what treatment has to be taken and how the protocol has to be taken. Then there are different kinds of receptors. I don't know whether your audience would like me to go into those detailed scientific names of estrogen receptors, progesterone receptors, HER2 receptors. So those are the receptors that that makes us choose what line of treatment to be taken, what chemotherapy has to be done, what immunotherapy drug has to be taken. So all this, so there are different types of cancers, Deepika. So once you are getting a biopsy done, you have to go for anybody has to go for a receptor test. So it is ER, PR, and HER2/neu. So ER is an estrogen receptor, PR is a progesterone receptor, HER2/neu is a protein, HER2 is a protein which is there around the breast, which makes the cancer grow at a much faster pace. So you have to get that test done. It is a simple test which comes on to IHC, immunohistochemistry panel. IHC test tells us what kind of a cancer is this, whether it is aggressive or whether it is less aggressive, or whether it is absolutely like a normal, not so aggressive, or I would say a very pale kind of a cancer. So that decides upon what line of treatment to be taken. If it is triple positive or ER positive or PR positive, I don't know. I don't have to go into that scientific thing, but yes, that's how makes any oncologist decide upon what treatment has to be taken and how it has to be chosen for that matter.
So here we have a question asking that, once if a person is diagnosed with breast cancer already, what she needs to do. So of course you have mentioned that, how to segregate the test and what test, but what is the first thing? Let's say, diagnosed ho gaya breast cancer. Now, what is the first thing one should be doing?
Okay, if anybody has been diagnosed with cancer, first thing is talk to your family member and then speak about it. Talk about it, the complaints, what exactly has been the complaints, and make a buddy, companion, comrade, or friend who is that companion or buddy who listens to you for all the complaints that are there. Why? Because you would need your family member or your companion to go along with you to all the doctors and make the right decision. Why I'm telling you? Because any lady who's been diagnosed with breast cancer would not be able to make out the right decisions. Right? So first thing, when you ask me, the first thing is find a buddy, find a companion, find a friend, find a family member whom you can discuss everything. And inform him or her that these are the complaints that are there. Right? And this is how you have to do. Remember, that buddy, that companion, that friend, that comrade should not be your spouse. Your spouse would obviously be a part of your fear, because the only thing that you're facing right now is your spouse or any lady who's been diagnosed with this, their spouse would be facing the same fears that you are facing, right? So you would never be able to make out those right decisions. So whosoever is in our circle, we always tell them that, find up a buddy whom you can discuss and tell, and then who is somebody who can be a tag along person, who goes with you in tandem, who goes along with you and discuss with and take opinion from the doctors. That's the first step. Second step is meet an oncologist and discuss about the reports at length. When you're discussing about the reports, what I told you is, when you're taking your companion, your friend along with you, it can be a friend or a family member as well, along with your spouse, is you ask questions. Make a list of all the questions that is possible and ask comfortably all the questions about what exactly would be the treatment, how would it be treated, what would be the total treatment duration, how would it be working upon, what are the treatment choices available, is there any drug whatsoever would be chosen, all those questions. And then I mean, uh, that's where, and then take a first opinion. You've gone through it, meet an oncologist, take a second opinion again. Then you've taken an opinion, go and meet a third oncologist as well. Take a third opinion. And then decide upon what has to be done. Never make a hasty decision.
So you have mentioned two things here. Firstly, of course, make a buddy, and second is go and find a oncologist and discuss at length with the oncologist. So would you like to tell us that, since our subject is 7 things you should be absolutely knowing, so we covered 2 things. So what are the rest of the things, if you would, tell us about those as well?
Oh, that would be great. So third thing is, whenever somebody has been diagnosed with cancer, regular checkups and regular screenings are very important. Why? Because what happens is, anybody who takes up any treatment, they always tend to make those decisions where whatever has been suggested to them, they just go for it. And then they forget that they have to be screened regularly. They have to be screened at regular intervals as well. So regular screening is something which is very, very important. Number 4 is an antioxidant rich diet. Very, very important. What happens is, they go for treatments, they go for mastectomy, they go for chemotherapy, they go for immunotherapy, but they don't take care of the diet. They don't talk about the diet, what they should be taking. So whatever the diet they take is only related to the chemotherapy that they're taking. So no raw fruits, no raw foods, nothing raw, no soups and all that stuff. But they forget that actually what you have to take is an antioxidant rich diet so that they can combat with the disease. And Deepika, I think this is your topic. This is your thing, because you're the best person to suggest an antioxidant rich diet. Would you like to speak about it?
Yeah, Tarang, of course, an antioxidant rich diet is the thing which keeps your inflammation down, which checks your, autoimmune diseases like cancer, and does so many wonders. And if we're talking about antioxidant rich diet, is the diet which are rich in color, like your red, dark green, jitna zyada color hai uska acha, utna zyada wo fruit ya vegetable antioxidant rich hai. And नाउ एंटीऑक्सीडेंट का मतलब मैंने पहले भी बहुत बार समझाया that हमारी बॉडी में फ्री radicals घूमते हैं which are oxidants, which we don't need in our body. And antioxidant rich diet, it works to take care, by taking care of those free floating unwanted oxidants in the body. So yeah, this is an absolutely must. And there are so many other things also. We have very good team of cancer dietitians, nutritionists, and we have been treating, giving cancer diets since like a decade now. So yeah, the common thing which I can bring it on the table right now is, one is antioxidant rich diet, vitamin C and vitamin D rich diet. Vitamin D is absolutely must because it's a cascade of all the hormones, and breast cancer is, because of a lot of hormonal imbalance. One reason can be hormonal imbalance. So yes, vitamin D is absolutely must. In fact, there is some myth attached with soy food, which are pseudo estrogens, which initially they were said that ये नुकसान करता है with the breast cancer. Yeah, phytoestrogen. Sorry for that. So initially, the research was saying that these are not good for the health, particularly for breast cancer. But now the new study says that it works very well for breast cancer patients. And again, dark green leafy vegetables, and so right from colorful vegetables to dark green leafy vegetables to good nuts and seeds, like flax seeds are again a very, very good source of various such nutrition which works very good in breast cancer. Well, there is a complete list of it. It should be a separate subject altogether. But so you have mentioned the 3 points, and I missed one point of Tarang, if you would repeat that again.
So number 1 is talk to your friends, family member, friend, comrade. Number 2 is regular checkups and screening. Number 3 is take a first opinion, second opinion, third opinion, or even fourth opinion, and never make history decisions. And number 4 is antioxidant rich diet, which is a must. Number 5, what I can say is, when anybody has been diagnosed with breast cancer, is important that they have to be open with the mindset of choosing the right treatment choices. So what happens is, anybody who's been diagnosed with cancer is, or breast cancer, I would say, is biased towards whatever the oncologist has fed it to them. Is what get it operated, get it removed, get the chemotherapy done. First, get it operated. B, remove the entire breast. 3, get the chemotherapy done, which is not the only treatment of choice. The other treatments of choice can even be immunotherapy. It can even be Ayurvedic. It can even be homeopathic. It can even be Unani. It can be other alternative medicines, treatment choices as well. So keep it always open. Keep it always open. I mean, we have seen cases where, the patients have actually gone worse even when they have been choosing just the surgery as well as chemotherapy, because they were supposed to get better, though they got worse. And they kept on trying 6 cycles of chemotherapy, then the other 6 cycles of different chemotherapy, and then the other 6 cycles of a different chemotherapy, and it never worked. When they come up to us, their disease has gone into multifolds and metastasized into other organs, which actually makes the situation more worse. So it is always there. Keep it always as an open choice. When I'm asking you to make multiple opinions and take oncologist opinion as first, second, or third, please keep it open for your treatment choices as well. And take those first, second, or third treatment choices and then sit down with a paper and a pencil and take out all those pros and cons. जो सही है उसकी सही अच्छाइयां लिखते जाइए, जो बुराई है, जो गलत है वो लिखते जाइए, and then again go to the doctor and ask for how would you be able to address all the negative points about your treatment. If you don't find an answer, don't start with the treatment. Simple. So problem is, whenever anybody has been diagnosed with cancer, they only resort to one thing: Google. And that's where, when you have to build a house, you go to an architect. When you have to fight a legal case, you go to an advocate. But when you are diagnosed with cancer, you always go to Google. You never consult an oncologist. First, whatever treatment choices Google tells you, it is all being fed by the pharma companies that has been pushing in a lot of money out there in that search engines, just to make you read whatever they want you to read it. And that's where you choose your treatments.
Yeah,
so it is like that.
It's a whole ball game separate. It's a kind of a marketing thing, to make to find the right kind of fishes whom the big markets and big industries can capture. But yes, one need to be updated about the various treatment available and choose the best one, what is good for you, what suits for you. Read about various things, ask multiple questions to your doctor, and not only chemo and radiotherapy is your treatment. There are so many other much more simpler and easier way which won't scare you, and which would also comfort you and take care of your other things as well, which people suffer from, which the women suffer from breast cancer. What are the 6th and the 7th point, Tarang?
6th is a point which is very close to your heart, is supplementation. So 6th is very good supplements always help in getting you treated. I mean, I've been seeing it. So how I almost see 150 cases per day of cancer, and all of them are being supplemented with those high doses of great supplements that your company has been providing. And we have been seeing such amazing results where they have been improving, they have been getting the right quality of life, and their energy levels it makes our life so much easy. When their energy levels are getting so much higher because of the right doses of antioxidants, when the right doses of supplementation, right doses of vitamin C, right doses of vitamin D, right doses of the phytonutrients that are required. And I think, why don't you speak about it, the number 6 point? supplements?
Yeah, because when a person is facing for any kind of autoimmune disease, cancer, anything which is a chronic disease, of course, your body is not able to absorb all kind of nutrition which the food is providing you. I mean, we already know that the food which we are eating these days, it does not contain all the nutrition. It's already half the nutrition is gone because of the process of how it is grown and how it is reaching to us. But with a patient of cancer, the absorption power is more weak because the cells are already multiplying in a very disordered way, and the person needs to be the body is busy healing that area, so your general absorption from the food becomes very, very low. Here, the supplements are helpful because firstly, it is covering all the nutrition which your body requires. Number two is that the supplements are very highly bioabsorbable form. So your body, your gut-brain barrier instantly absorb it, your blood-brain barrier instantly absorb it, and it takes out the maximum nutrient which your body requires. So a cancer patient, if anyone knows here, do have a lot of lack of nutrition. That is why a very good diet and a very, very good quality supplement is absolutely necessary with with their treatments as well. So you cannot miss it. That's why good quality protein, good quality whatever is lacking in the person is absolutely must. But again, these should be taken only by the recommendation of doctors, and after consulting your doctors, because not all the supplements are for you. So the doctors are the right person who would suggest you that what is good for you. And coming to the seventh point.
And very important is not to Google it and consult your doctors, because doctors would actually guide you whatsoever has to be done and whatsoever has to be taken. Don't just Google it and find the symptoms and go and get it treated and go to a chemist and get that medicine. I mean, very important not to Google it and go and meet your doctors. Yeah. And last point is, again, on TBTF, tight bubble of total focus. Complete tight bubble, like an astronaut. You have to wear that tight bubble off so that none of the negative mindset, none of the negative approaches, none of the negative thoughts of your family members makes you get affected of your treatment. I always say strong willpower, determination to fight, and correct treatment makes you win over cancer. Strong willpower, अगर willpower बहुत strong है, determination to fight अगर जीतने का जज्बा है, और अगर ट्रीटमेंट सही, तो ऐसा नहीं हो सकता कि आप ब्रेस्ट कैंसर से बाहर नहीं निकल सकते. But what happens is people lose their focus. Girls, women who have been diagnosed with breast cancer, they lose their focus. They tend to get succumbed, or they tend to get weaker, and that's where they're not able to make those right decisions. That's where the point number one comes into the picture. A perfect companion, perfect comrade, perfect friend, perfect companion, perfect friend who you can discuss and take it along and tag along for all the treatment journey. Why? Because that's where you need that motivation time and again of having that tight bubble of total focus that you have to get where. It is a journey that happens, Deepika. So cancer healing is a journey. It is never, so you have to enjoy every day. You have to live every day. You have to have those micro wins every day. Have those tiny goals. You can't win a match on the first ball. You are chasing a target. You are facing, you have to reach there, but you just can't do it in a day. So that's where that mindset of, total focus is important. That consistency is important, that you don't lose charge.
Yeah, like they say, one day at a time. So yeah, I mean, definitely take one day at a time, and make your recovery wonderful. So we have discussed enough that what one needs to do about when a person is diagnosed with breast cancer. But could you also tell us that what are the things which one can avoid doing so that you can stay away from breast cancer, or you can just not let it happen?
Oh, that's an interesting question. What you can do to make sure that the breast cancer does not happen is very simple. Stay away from all the tamasic things that happens in your life. Stay away from negative. I mean, very simple to say, but very hard to follow is stay away from stress. When I'm saying staying away from stress is, again, tight bubble. So whatsoever, even if you are traveling in a car and the journey, there is a lot of traffic jam, lots of nuisance, lots of chaos outside on the road ahead, but still you are into that tight bubble that you're not getting irritated. Constant irritation causes cancer, Dr. Deepika. Constant irritation causes cancer. So you have to make sure anybody who's have to stay away from cancer is make sure that they do not get irritated at any given point of time. Mental irritation, spiritual irritation, physical irritation, or emotional irritation. Anything which is getting irritated physically, any lump which is there, again, it might be cancerous. Any emotional irritation, somebody who's in grief, somebody who has lost a family member and is in grief for a longer period of time. Or grief is something which is one symptom which I've seen in so many ladies coming up where they lost their kids, they lost their family members, and they were in grief inside and they did not share their emotions. Diagnosed with cancer. I'm talking about out of experience. Then these are the ailment factors which are there. Something which you can avoid. So you have to make sure a positive mindset, but positive mindset is a very broad term. What is more important is into that thing where you're not getting spiritually irritated. You are not getting emotionally irritated. You're not getting, even if you're getting irritated for a moment, you're coming back into your center. I mean, the way you do what I would say, when you have seen, when we see our kids doing surfboarding, you have to align yourself towards the center so that you can balance onto your surfboard. Exactly how life is. You have to align yourself towards the center so that you don't lose track of. I mean, we should not be debated either towards the left or towards the right. It is always like you're always coming back to your center all the time. So this has to be really strong.
Yeah, but
mindset has to be really strong.
Staying in balance and avoiding stress is the most hardest thing at this life, because of course there's so many things one has to deal with, but yeah, I mean, it's a constant work which one has to work on, but yeah, I like your statement mentioning that constant irritation causes cancer, which is physical, mental, or any kind of constant irritation. So yeah, that's a quite insightful knowledge which you have provided. And anything else, Dr. Tara, would you like to mention before we end our session today to our audience here? Or let me take some questions, because we do have, here we have a question that does your therapy cure cancer without taking chemo? I think this question is for you, Dr. Tara.
It does. It does. Log on to www.cancerhealercenter.com and then you'll find plenty of cases. Go on to YouTube videos, see almost hundreds of success stories where the patients have been treated without chemo and they have been cured. The reports came normal. And when I'm talking about cure, it is a complete and permanent restoration of health. So that's how it is. Yeah.
Okay.
So
and
I mean, I don't. Yeah.
And what are the treatments for cancer other than chemo, radio, and hormonal target?
Target therapy, immunotherapy. Immunotherapy is one of those treatments where, so in breast cancer, it is according to the receptors, either it is ER, PR, or HER2/neu. So when there are receptors which have been there, so for chemotherapy is, triple negative cancer, breast cancers are difficult to treat by chemo. And that's where immunotherapy comes into the picture. And that's where immunotherapy brings about that role of treating the disease from its roots, where the disease never tends to come back. So those are those treatment options as well. I mean, all this literature and all those information is out there in our website as well. Yeah.
The next question is how to choose a right treatment option once diagnosed with, confirmed with FNAC.
Once you have been diagnosed, once anybody has been diagnosed with FNAC, to choose the right question, I've already said you have to take opinions from doctors, first, second, third, or fourth. Take out a paper, write down all the options, write out all the positives, then write out all the negatives, and go and speak to your doctor. And whatever negatives that you find, go and speak to your doctor. Doctor, how are you going to treat all those negative points? Like, that there is a hair loss after chemo. So ask your doctor how you are going to deal with it. Ask your doctor how you are going to deal with all the blisters, all the counts going down, all the hemoglobin going down. If there are no side effects like immunotherapy, so ask those doctors, how would you how would you assure, or how would you make sure and ensure that the disease does not come back again? So those are those treatment choices where you need to be very, very clear enough, is, choosing all the right set of treatments, making those treatment choices, and then finally coming to it. Is cancer an autoimmune disease? Absolutely not. Absolutely not, Shilin. It is not an autoimmune disease. Yeah.
We have one more question there. Do we have to get choose in clothes to avoid breast cancer?
Do we have to? Sorry?
I think she means here that, what kind of clothes one should avoid, or, is there any specific that, this kind of thing can be done to avoid
so
regarding clothes?
You don't have to wear those tight clothing where those what do you call it, wired bras, that should be avoided. Wired bras is something, a strict no. Something where anything which is harmful. So any wire that is leaving a mark onto the breast can be dangerous as well. So that is where you have to make sure that something, when you're already anybody is having a lump in the breast, is something you have to make sure that to every action there's an equal and opposite reaction. That's a Newton's law, right? So if you're trying to push it furthermore where it has been diagnosed, or if there is a lump out there, if you're trying to push it more, it will try to erupt out a lot more towards the outside. So that is where you have to be cautious enough that you wear loose clothes, you wear loose clothes, you wear cotton bras, you avoid synthetic, where there is not, you have to wear breathable clothing, right?
Yeah, wired bra is definitely one thing, and also protecting your, like, from the sun, harsh sun, covering, wearing nice cotton clothes, avoiding or wearing least possible the other synthetic fabrics are the best, way one can. But it goes in general, whether it's your breast or any part of your body, you have to wear breathable. One should wear more breathable clothes
Breathable
as
clothes,
much
yes.
as possible. I think we have covered most of the questions. If I have missed some questions, please DM to me or Dr. Tarang, anyone. And a few of the questions are there, but we have already taken those questions during our conversation. So what is the, end thing, or what is the last thing you want to say before we close our session today?
One thing that you have to remember is simple MEDS-RX, meds RX, MEDS and RX. So if you follow this simple thing in your life, you would always stay away from cancer. You would always have a great lifestyle, or you can, even if anybody is being diagnosed with cancer, you can make it much more simpler in their life. M stands for meditation. Your mindset, your mind is where you have to calm your mind, when you have to calm your body with having a coordination between your mind and your body. So half of the time, or rather I would say most of the time, is when the mind and the body are not coordinated with each other. That's where the problems begin. So if your body is calm, if you're working out on your body, but you're not working out your mind, that's where you are going to make it worse for yourself. You have to take a workout of your mind as well, where you have to meditate, you have to introspect, and you have to live and see within, to see to see inside out. That's where it is. E is for exercise. Needless to say that you have to exercise every day, take care of your body as well. D is for diet. Again, as you said, Dr. Deepika, diet is the most important thing, which is useful in your body for your daily lifestyle of what you're putting into your inside your body. So D is for diet. S is for sleep. Now, this is the most neglected thing which people don't realize is sleep. People don't sleep for typically 7 to 8 hours. Even if they have a late night, they get up at 6 and go back to their own vivid routine whatsoever they have, without compromise, without realizing that if they're compromising their sleep, that would make them prone to diseases. R is relationships, very important. Have great, beautiful, meaningful relationships. Do a lot of conversations. Have those relationships which nurture you, which make you grow, and which make you better. And X is that X factor, that right treatment that you choose, the right supplementation that you choose, the right nutrition that you choose. For me, what I always say is health reset is my X factor. So, and X is your X factor, if whatever the treatment that you choose, whatever the supplementation that you choose, that always uplifts your energy. It always uplifts your soul. That always, you're pretty sure enough that it would make you come out of your disease. So meds are, it's something which is really powerful that I always tell my patients to follow it. Yeah, that's the only thing, Dr. Deepika.
Very well put up together. The abbreviations is MEDSRX, MedsRS. So if you want to know the full form of this, or you have missed the session, you can always go back to the recording here, which would be here at Immunosciences in the IGTV video, and you can anytime come back to the recording and take notes and follow the instructions, whatever is being said here. So, I mean, the questions are flowing in. There's one question which I would take again is that should we avoid doing exercise in case of breast cancer?
Yes, you should. Depending on what kind of exercises, you need to speak to an oncologist, and don't do any exercises or jumping jacks or whatsoever where there are which is quite heavy for your body and you are not able to. It depends upon what stage the breast cancer is it in. If it is just a lump out there, try lifting up heavy weights. Try lifting up anything close. So even those heavy bags, handbags, closer to the chest, leather bags, lifting up weights, lifting up dumbbells, doing those exercises, that should be avoided. Try doing it more of breathing exercises. Try doing more of pranayama. Try doing more of anulom vilom. Try doing more of, even after workout, you can do a running, but when you're doing it, do wear a sports bra or a tight bra, which doesn't bring too much of vibrations or friction to your breast, So all to be, I mean, that's what is just at length. And ask N numbers what oncologists are there for. We're always there to help. So do ask those questions. Yeah.
That was really informative, and a lot of things I think our listeners definitely must have learned. And like I said, if you have missed anything, you can come back to the recordings and check see the recordings. Thank you so much, Dr. Tarang. And, we have not been so formal,
I know.
but I'm glad that
As
we can
said,
also.
this is the first Instagram live for me, and I'm blessed that I'm doing it with you. And it's a blessing because you have always been a pro in for Instagram live. This is my first one, so I was actually getting those. I can deal with any interviews, any sessions out there for any TV channels, but when you're doing it with your wife, it is the toughest.
Yeah, I think I understand this. But anyways, you did a good job, I'll say. And the session was really informative. And thank you so much for taking time from your busy schedule,
Thank
as
you.
I very well know that. And yeah, so it's a good, the
Thank you.
session ends and it's a good night for everyone. And bye.
Thank
See
you.
you guys soon for the next session. Bye-bye.